right, let's review some practice questions covering content within the labor and birth and maternity section of the course. As with all of our practice question videos, I do ask that you pause the video after we initially review the question and the answer options. That way you can come to the correct answer independently using your own knowledge and foundation base, and then you can resume the video and we can discuss the answer and the rationale together. All right, this is a multiple response select all that apply, testing knowledge of physiological integrity. The nurse is caring for a 30-year-old patient who is in active labor, and has been experiencing regular contractions for the past 6 hours. During a cervical exam, the nurse notes that the patient is fully dilated and effaced. The fetal heart rate is being monitored with an electronic fetal monitor, and a pattern of late decelerations are observed with each contraction. Which of the following interventions would the nurse anticipate at this time? Select all that apply. So the fetus is presenting with late decelerations. So which nursing interventions are you going to anticipate? All right, so you're going to administer supplemental oxygen via face mask and then place the mother on her side. So late decelerations are due to uteroplacental insufficiency and often occur because of decreased blood flow and oxygen to the fetus during uterine contractions. So hypoxemia therefore results. So oxygen at 8 to 10 liters per minute via face mask is a necessary intervention. The supine position is avoided because it decreases uterine blood flow to the fetus. The patient should be turned onto her side to displace that pressure of the gravid uterus on the inferior vena cava. Also, an IV oxytocin infusion is discontinued when a late deceleration is noted. The oxytocin would cause further hypoxemia because of the increased uteroparenteral insufficiency resulting from stimulation of contractions by the medication. All right, this is a multiple response select all that apply, testing knowledge of physiological integrity. The nurse is caring for a newborn via C-section at 35 weeks. The newborn was born at 35 weeks, approximately 15 minutes ago. The patient weighs 4.6 pounds and is measured to be 18 inches long. When caring for the newborn, which of the following would be of immediate concern to the nurse? Select all that apply. So which of these findings are abnormal and would be of concern to the nurse? All right, so respiratory grunting, relaxed body posture, and a temp of 96.7 are all concerning findings. So respiratory grunting could indicate respiratory distress and impaired gas exchange. A normal respiration rate is 40 to 60. Fine crackles are common and can be expected, but coarse crackles are abnormal and would be concerning if they were present. A mottled skin is normal. A relaxed body posture is concerning and could be the result of muscle atrophy, which could result in respiratory compromise. A normal heart rate is 100 to 160. And then a temp of 96.7 is below normal and should be of concern, and murmurs can be typical for a newborn. All right, this is a highlight in text style question testing knowledge of physiological integrity. A 29-year-old pregnant female patient presents to the emergency department with reports of a sudden gush of fluid that occurred 2 hours ago. The patient is admitted to the labor and delivery unit for closer monitoring. The labor and delivery nurse is performing an admission assessment and notes the following. The patient is 35 weeks gestation. She is a G2P1, which means that she has had 2 pregnancies, but only one has survived to 20 weeks gestation or more. She's had a slight continuous vaginal fluid leakage since the gush that happened 2 hours ago. She has a history of heavy tobacco use and a history of chlamydia earlier in the pregnancy that was treated with doxycycline. So highlight the findings that are of immediate concern to the nurse at this time. All right, so the patient has likely experienced premature rupture of membranes with a leakage of amniotic fluid before the onset of labor. So, risk factors for premature rupture of membranes, which is evidenced by this sudden gush of fluid that the patient has felt, risk factors include cigarette smoking and a history of GU infection, which the patient has both. The nurse would be concerned for the development of infection of the amniotic cavity at this time. She'd be concerned for sepsis or even placental abruption. All right, this is a classic multiple choice testing knowledge of physiological integrity. The nurse is caring for a 28-year-old patient who is in active labor and has been experiencing regular contractions for the past 4 hours. The fetal heart rate is being monitored with an electronic fetal monitor, and a pattern of variable decelerations is observed. The nurse notes that the decelerations are not associated with the uterine contractions and are instead occurring randomly. The nurse immediately notifies the physician and expects which of the following. So the fetus is experiencing variable decelerations that are not associated with uterine contractions. So which of the following do you suspect? All right, so the correct answer is umbilical cord compression. So variable decelerations occur if the umbilical cord becomes compressed. This will reduce the blood flow between the placenta and the fetus. So associate variable decelerations with umbilical cord compression. All right, multiple response, select all that apply, testing knowledge of physiological integrity. The nurse is caring for a 31-year-old patient in the first stage of labor. With continuous fetal heart rate monitoring, the nurse notes the presence of late decelerations and episodes of fetal tachycardia in response to the decelerations. The nurse concludes that which of the following conditions could be taking place? Select all that apply. So the patient or the fetus is experiencing late decelerations and tachycardia in response to those decelerations. So what could that indicate? Select all that apply. So the presence of a deceleration can be benign or it can be normal. Early decelerations can be normal and are often caused by fundal pressure, breech positioning, or vaginal exam, whereas late decelerations are abnormal and are caused by fetal hypoxemia and uteroplacental insufficiency and are therefore very concerning.